Hello again, everybody. It's Colin Talbot, and we're talking about the coronavirus pandemic. And today I'm joined by two colleagues from Australia, Helen Dickinson and Janine O'Flynn, who are both professors. Janine's at the Australian New Zealand School of Government and Melbourne, I think. Have you still got your place at Melbourne? Yeah. And Helen Dickinson is at Melbourne. No, sorry, I got it wrong. Helen, tell me.
University of New South Wales in Canberra.
Ah, sorry. Yes, of course. I don't know why I thought that. Okay, right. If we could get started, what I wanted to do first of all was just go over what the position is in Australia at the moment with the virus, with the epidemic, and just get some picture of how bad it is there. And maybe if you could say something about if there's geographical concentrations or particular parts of the population that are being affected, that would be really useful. I don't know who wants to go first.
Yeah, I mean, I'm happy to just give a little snapshot, and then perhaps we can talk a little bit about where the concentrations are. So for those of you who are unfamiliar with Australia, we have a population of about 25 million people in Australia. The latest data, which is the 16th of April, is that we have confirmed cases 6,469. We've had 63 deaths from COVID-19, and we have got sort of differential experience across the country. For those of you who have never visited Australia, it's a very big country with a population that mainly sits along the eastern seaboard. So the large sort of clusters of population there is where we're starting to see cases emerge. So New South Wales, Victoria and Queensland have had the highest numbers. They're also the highest population, so that's to be expected, but we've started to see clusters emerge in smaller places as well. So the state of Tasmania, which is relatively small and detached from the mainland, has had a cluster identified there, and we've got differences across those states and territories emerging. So that's sort of the latest sort of baseline data. We're starting to see a drop in daily cases identified across states and territories, because as we'll talk about later, we've had a pretty lockdown situation happening in Australia for a while now.
How quickly did the lockdown start after the first cases were detected?
I think I mean, Australians would say it happened pretty quickly, but there was a fair delay in decision making. Helen can chip in at any stage, but once it happened quite quickly, and it happened in a very different way because of the sort of jurisdictional makeup of Australia. So, and we can talk a little bit later about the institutional response and how the national government is working with state and territory governments. But some states went hard and they went early, and they went pretty fast. So the state of Victoria, where Helen and I are both physically located at this point in time, went pretty hard and pretty fast into very sort of social distancing, into rules around how many people can congregate together. We've had basically a shutdown of entire industries in the state of Victoria, as some others have developed as well. So some went much quicker, much harder and much faster than others. But there's now developed quite a coordinated response, which is accounting for some of those differences as well.
Thanks. It might be useful if we just did a quick Australian Government 101 for people who are not familiar with the structures of Australian government, so that people have got an idea why you can have different responses at state level, for example. Helen, do you want to come in on that?
I'll start and test out my knowledge of Australian government, and Janine can tell me when I get it wrong. So, I mean, it's a federated system. So federally, there's a bunch of stuff that are controlled at the national level. And then the states and the territories have a large amount of control about what happens within their jurisdictions. And I mean, with an outbreak like this, you get really interesting divisions, thinking about things like the health system. So health is controlled at the primary care level. So your GPs and community care services, they're controlled under a federal system. whereas states have responsibility for hospitals. So as you'd imagine, there are some splits that emerge just in everyday kind of responses around health issues, but you put that into a context of a pandemic and it gets even more serious. Janine was sort of talking about some of the states had gone earlier on lockdown, and there's been quite a lot of confusion around the country actually about what things are allowed and what aren't. Schools are another thing that come under state jurisdiction. So in Victoria, it was announced that schools would finish a couple of days early before the school holiday. They would close down to stop movement of people, and they haven't reopened for most children. Essential workers can send their children to school, but certainly would be encouraged not to do that. Whereas at the time the Prime Minister was saying that schools were still open. That was the federal position, that schools were open. So there's been a lot of confusion, and certainly there's a number of the different news sites have accounts of what it is you're allowed to do in different jurisdictions, and what you can't do in those. And police is another issue. So some people in some jurisdictions, Victoria and New South Wales particularly, people are copping fines for breaking social distancing rules, but they're being enforced slightly differently across different jurisdictions. So, which is confusing on a national level, but also there's a fair number of people who live quite close to these border areas, and so in their daily life kind of operate under both sets of rules.
All right, yeah. Janine, did you want to add anything?
Yeah, I mean, for those who aren't familiar with Australia, it's a weird hybrid actually, which is in many ways Australia borrows from around the world. So some people talk about the Australian system of government as being a Westminster system, borrowing some stuff from the US and some from the UK. So we have an interesting mix, and what Helen says is exactly right. It's at these points we live with ongoing sort of tensions about things that aren't written into the constitutional division of responsibilities. We have entire court cases around this, and of course we have sort of ways of negotiating those over time have developed, but in a crisis they become quite stark, and you start to see those tensions, and I think the ones that Helen mentioned are terrific ones. So we know that today, for example, I think in Victoria only 3% of enrolled students went to school. At the same time, as Helen mentioned, that the Prime Minister is just yesterday was sending out a sort of national plea to teachers to return to the classroom and make sure that schools could operate. So there's all of this sort of communication issue which is emerging. And we've also got really interesting things happening around an area that Helen spends a lot of time talking about, so she might chime in on this, which is around borders. So we have sort of internal borders and a national border. So several jurisdictions in Australia, I think it's 4 at the moment, have locked the internal borders within Australia. Really? So people can't really cross across different state and territory lines without reasonable reasons for why they should be. And so we've got an internal policing of those sort of borders, as well as an external policing of our borders, where we've basically shut down Australia to international travel, except in very specific cases, mainly bringing Australians back home or sending foreign nationals back home. So there's a really interesting sort of story, I think, that Australian scholars will be looking at for some time, about this mix of borders within the country and externally, and how we've sort of negotiated that in a time of crisis. So for states still to retain some right to lock those borders is a pretty interesting sort of institutional challenge for government as well.
Yeah, just before Helen comes in, I mean, one of the things... Sorry, Helen, can you just 1 second? I was just going to say, just before you come in, that the sessions I've done with people from the US and from Canada before this, very similar sorts of problems about tensions between federal and state level, and even between competition between states has come up, particularly in the US, with states trying to get hold of supplies of things like testing equipment and ventilators at the expense of other states in some cases. Helen, sorry, I didn't mean to cut you off.
That's okay. I was just going to say the other thing probably about the Australian system that's interesting from a British or that European kind of background perspective is we haven't mentioned local government, and we do have a tier of local government in Australia as well, although it's generally I think it'd probably be fair to say it's generally not terribly well regarded, and the kind of quality of responses is quite patchy, is really dependent on local areas having really strong leadership. And I guess local government hasn't really featured hugely strongly in the debates that we've had so far around COVID-19. And then I guess the final thing, just to contextualize this as well, is unlike a number of other places, Australia is relatively wealthy, and has quite a lot of public spending available to it. And, the story of the crisis so far has been a huge number of different programs and investments announced at both federal and state levels, and some really expansive programs that has probably turned in some way what's quite a conservative federal government. Some have been led to describe it as practically social democratic in the face of the COVID-19 pandemic.
Can I just pick up on one other thing? Janine kindly sent me a link to an interesting piece about this national cabinet that's operating. Can you explain that, Janine? Because I found that fascinating.
Yeah, it's a really interesting, I would say, it's an interesting innovation in institutional practice in Australia. So, we have a cabinet operating at the national level normally, but what's happened is that a new sort of national cabinet has emerged, which is representation from each of the states and territories and the national government operating together in this new style cabinet making decisions. Now, there's a couple of things that are really interesting sitting behind that. One is that Parliament in Australia has been suspended. So that raises a whole set of other issues about where decisions get made and how accountability is enforced. And certainly some of the other jurisdictions have suspended their parliaments as well. So in the state of Victoria, where we are, Parliament is also suspended. So there's a sort of new process of cooperation happening. But for those of us who are in the weeds on what happens in Australia sort of over time, we already have an existing institution which is called the Council of Australian Governments, which brings together all of the governments of Australia, but that hasn't been used in this environment. And I think, again, that's something that over time we'll start to explore why that wasn't used, what is seen to be sort of the problem with using what we call COAG, the Council of Australian Governments, why we had to set up yet another institution. And part of the sort of public debate that's going on in Australia at the moment, which happens in many jurisdictions in crisis, is, wow, this is happening. It's working really effectively. Decisions are being made in a much more collegial and cooperative way. We're still getting a national response, but allowing for differentiation at the subnational level. Why don't we keep this? And it's going to be really interesting to see over time what will happen. I think what happens in crisis rarely can work in business as usual. And that's why we haven't used COAG, which is an existing institution with a history of actually rolling out quite large-scale reform.
Right, it's interesting. Helen, did you want to add anything to that?
No, that's a good
okay.
account.
Could we, sorry, excuse me, could we sort of turn to how well prepared Australian governments at federal and state level were for something like this to happen? Because one of the things that's emerged from quite a lot of conversations is that some of the governments in your part of the world, because of the SARS outbreak 15 years ago or so, were actually pretty well prepared, and they knew what to do when something like this happened and reacted extremely well. I just wondered how Australia compares to places like South Korea and Singapore, who've jumped on this very hard at the beginning. Who wants to go?
You want to start, Helen?
Yeah. Well, I mean, Australia is looking to those countries and being inspired by them. I don't think we've jumped on those issues in the same way as strongly, and I think the response has taken a little longer than it has in those countries, and certainly in the interactions with different public services that I've had people are learning and they're developing plans. And some of that's because some of the institutions are quite new. So I've been doing a lot of work in the pandemic with people in the disability sector to try and advocate for a more effective response from the government around people with disability who are highly kind of vulnerable in the context of this outbreak because of pre-existing health conditions, but also because of the way that systems and services are set up. And we've got a new national disability insurance scheme that's been going for a couple of years, but they actually had to develop a pandemic plan, so they didn't have one that pre-existed, and to some extent, fair enough, they're quite a new organisation, but my experience has been that's something that a lot of different organisations have had to do as well. So there is quite a lot of scrabbling around to put things in place, and I guess with any outbreak, I mean, it is a very different kind of situation than those we've had before, but I don't think we're quite as prepared as we would like to have been.
Janine, did you want to add to that?
Yeah, I mean, there's a really interesting debate going on in Australia about our preparedness, and there's, I think, sort of a couple of distinct views. As it happens, when like each of us, you spend your sort of career researching government. I spent some time in the late 2000s looking at pandemic preparedness in Australia as a case of how different levels of government work together. So there was large investments in developing a pandemic preparedness plan and response, particularly after avian flu in Australia, and a very strong commitment by the government of the time, a Conservative government, to invest large amounts of money in the national stockpile to ensure that we had vaccines and that we had equipment and so on. And but there has been critique over time, over the last decade or so, about how well that's been sort of kept up to date, how the stockpile's been managed and so on. So there's a piece actually in the national media today, which is sort of doing this critique of the plan, saying actually this was absolutely in our sights. We knew that something like this would come. We knew the scale of it. We've been planning for it for at least a decade or more. Very similar to this, it would transmit like this. We would have all of these issues with supply chains. We would have all of these issues with equipment. But once it's hit us, our plan is outdated. So there's an interesting sort of division, I think, in the debate. So as I said today, a piece in the national newspaper saying, on the one hand, the Prime Minister saying this was unimaginable. The Deputy Chief Medical Officer saying we've been preparing for a pandemic that we thought would be like this for many years, and a plan sort of in the middle, which was developed in the aftermath of avian flu, in a sense that Australia had to be able to respond to that. Massive investments at the time by government, but some have said sort of an erosion of that. I remember at the time studying and doing the fieldwork looking at pandemic preparedness, and the epidemiologists in particular were very worried that what had been a pandemic only preparedness group in the Prime Minister's department had been turned into what was then called an all hazards group. So they said the pandemic was now sort of out of the spotlight. They needed a group that could respond to everything from terrorism to a pandemic. And what that meant was that the capability was lost over time to respond to that. Hugely complicated plans. They did a whole range of exercises to sort of see what would happen if a pandemic arrived, what would they do with airports. So they did all of that. But the idea now, sort of looking back on that, and some of the critique that's starting to emerge, is that they didn't keep it up to date. Yeah.
And
so
I guess really,
the
and there's a lot of fatigue as well. So don't forget that across our summer, your Northern Hemisphere winter, we had really significant bushfires across the country that wreaked huge devastation. They were followed quite quickly by huge floods in a number of areas as we got really huge rainfall, which was welcome. It put out the fires, but led to floods then. And so a lot of people didn't have a summer break, and the services are pretty tired from that. And then to be hit by the pandemic soon after, as Janine says, as good a plan that you have, some of that goes out the window once all of those factors come together.
Yeah, sure. I mean, it's one of the issues here is that there was a lot of planning for the possibility of a pandemic, although it was mainly focused around a flu pandemic. But the former Cabinet Secretary Gus O'Donnell admitted a couple of weeks ago that they'd done the plans, but they hadn't actually followed through in terms of putting the resources in place to make sure they could respond quickly when it happened. The other big issue here has been the level of communications about what the strategy of the government is in all of this. I mean, for example, this morning, Matt Hancock, the health minister, was on the radio and was getting a bit exasperated because he kept being asked, well, what's the strategy for getting out of the lockdown that we're in at the moment? What are your policies? And his response was fascinating, because he said, if we start talking about things like that, you lot out there will stop concentrating on the need for a lockdown. So we're not going to tell you what our plans are, which I don't think will have gone down terribly well. And certainly the general communications from the government here have been pretty appalling. So I just wondered, some other governments have been much better and much clearer, and your near neighbours in New Zealand have particularly been getting a lot of congratulations for having a very clear, well articulated strategy. I wondered what's been going on in Australia.
Well, we had an announcement today actually around some of that. I mean, as we say, the communications have been mixed because you've got these different issues across the states and territories and the federal level as well. But today we were told by the Prime Minister that the lockdown scenario we're in is going to be for at least another 4 weeks yet. And a lot of people have been wondering about the kind of length of time around that, and particularly given, as Janine said earlier, the number of cases in comparison to other countries are not anywhere near those sorts of levels, and so it's difficult to keep people focused on those sorts of issues. But I think he outlined 3 things that he said would need to happen before we saw a big, start to loosen up on those restrictions. And one was to have more widespread testing. So, like in a number of other countries, there's been real debate over challenges in getting access to testing, and so really want to increase the capacity around that. Also, something around improving contact tracing. And there's some talk about using an app that's been used in Singapore and somewhere else as well, although there isn't a lot of clarity over what that looks like and what it does and what information that shares, and so there's some concerns around that. And then the last thing I think was around making sure there's the capacity at a local level to be able to support any initiatives to start to open up a lot more. So we're seeing deployment of defence forces and things like that locally to bolster existing resources that we have there. So that's the latest message on the strategy.
Thank you. Janine, did you want to add to that?
Yeah, I just want to think about the lockdown in a few different ways. So one of the things I mentioned earlier was that Parliament in Australia has been suspended, the national government and also at subnational in some cases. So the other thing that the Prime Minister announced today coming out of the National Cabinet meeting was a trial return of Parliament in May. So they would try and do that, but they noted that the internal border restrictions in place might prevent politicians from coming to Canberra. There's been a real barrier to doing actually democracy via Zoom, if we want to call it such a thing. So we've had some real sort of debate around that as well. The other thing that he said in the sort of presser that he did today was that restrictions would be expected to be running probably over the next 6 months, but all of those decisions would be taken based on health and economic advice. One of the things that Helen mentioned earlier, which is really important in the Australian case, I think, to reflect on, particularly compared to most other nations, is that we did not suffer the economic catastrophe coming out of the global financial crisis that most other nations had. So Australia is spending a lot of money to try and basically prop up its economy so we can go into what some people are calling basically hibernation, into an economic hibernation. And so we are seeing, I think the latest numbers are 300 billion Australian dollars. I think we're talking about 16, depending on the numbers, 16% of GDP. We're right up the top of the spend of governments in responding to the crisis. That's everything from at the national level, funding massive expansion of sort of protection of jobs through to specific industry packages. Just yesterday, the Victorian Premier in the state where we are announced a $500 million package to protect renters who might be evicted, and landlords, many in Australia who derive their income from our bizarre taxation system, which allows them to develop large incomes based off owning multiple properties and renting them out. So there's this just a massive expenditure, and Australia also spent its way out last time out of the global financial crisis and did that successfully. One of the issues that comes with that is that we've had basically 30 years of uninterrupted economic growth and generations who have never experienced anything like what will come or what's predicted to come in the coming years. We've had massive pressure on the welfare system. We can't get people signed up quickly enough. Unemployment's going to go through the roof in a sense of that Australia has never, certainly a generation of Australians have never seen, and how capable our government is going to be to deal with that, I think will be a question that's coming. The initial sort of surge in that was catastrophic in terms of people even being able to sign on for welfare. We've seen a very generous sort of expansion of welfare payments, but I think the sort of psychology around that will be really difficult for a lot of Australians to deal with in times to come. So we are spending, and we're spending huge amounts of money to try and create a sort of soft landing after the end of the virus. But we didn't have the sort of experience that many countries had in the GFC. We have not been into recession.
Right.
But it's coming, and that will be a big problem for a government who sort of finds itself in that environment here in Australia.
Yeah, I just want to pop back to something that Helen said earlier about the development of an app. You might just plug. I'm doing an interview early next week with the chief executive of the IT company that's developing apps for the Danish government. They're developing two. One is a contact tracing one. It's one of these smartphone apps where you can download it, and if somebody's identified as having got the infection, that they can trace who they've been near by the Bluetooth signals off the phone. So he's going to tell me a bit about that. The other thing they're developing, which we've sort of got here, is an opportunity for people to register online and report symptoms, even if they're well. So King's College London has developed an app here to do that. The Danish government are doing one which is official and uses your official ID number, Danish government ID, to log you in, and you can report daily or weekly, I think, what your symptoms are, so they get a much better idea of the spread. And clearly one of the issues over a range of countries has been the poor information about exactly how this disease is spreading, because without testing, there is no way of knowing adequately, and certainly in the UK we've no real idea exactly how far it's spread, because we've not been testing anybody except people in hospital until very recently. Is there anything else finally you'd like to say before we wind up? I'm sure we'll be coming back to some of these discussions in the future. Unfortunately, I think this thing's going to run and run.
I mean, the one thing I've been spending a bit of time thinking about disability in the context of the pandemic, and one of my reflections would be that some of the shifts that we've taken in policy terms that follow, where you've gone in England and other jurisdictions around the personalisation of different services, I think has come onto a real collision course with this pandemic. So we've seen personalisation in disability services around giving people individual budgets to fund their disability services, and this has been rolled out in the aged care context as well. And one of the challenges that's raised is in the context of pandemic, there isn't a disability workforce that you can mobilise. So some people work for providers, and some of them might be big providers, but a lot of individuals are employing individual personal assistants or support workers through that sort of arrangement. And so it throws up interesting things like employers are supposed to provide personal protective equipment. So essentially what we're saying is, if you're the employer of your support worker, that you're supposed to be providing equipment to them. So it raises questions about how does equipment get out, who does the training around infection control, and given that more support workers are now employed in a gig economy type arrangement, effectively, are we incentivizing people to go to work when they may be ill because they don't have any other option? Because if they don't go to work, they don't get paid. And there has been an outbreak of COVID-19 in a nursing home in Western Sydney. There was a worker there who went into work, and I think there's about 15 cases confirmed within that location now. And it raises a lot of really important questions about, have we set up these sorts of policies that really make it more challenging to respond to events like this?
Yeah, I think just before Janine comes in for a final word, that's very similar to what's been happening in the UK, in England in particular, where care homes have largely been transferred into the private sector. As you say, there's also a lot of personal care arrangements for people living at home still. And so you're dealing with, instead of a few institutions like with the health service, where you've got a limited number of hospitals, you're talking about tens of thousands of care homes and hundreds of thousands, if not millions, of individual arrangements, which are just proving incredibly difficult to manage in this situation. Janine, did you want to just have a final word before we finish?
Yeah. I mean, perhaps I'll just say something a little bit about Australian tolerance for compliance and how challenging that might make it over the longer term. I mean, Australians and many people that will watch this will have encountered Australians in their travels, have a relatively sort of what we call a she'll be right attitude. Things will always work out. And part of that, I think, comes from being in a fairly isolated part of the world, and also living on a fairly hostile sort of landmass here. But in environments like this, that makes it very difficult, I think, in terms of implementation. So some of the things that have been happening in terms of putting in place a lot of these rules and, around social distancing and about how people can behave and where we're allowed to go out of our homes and what we're allowed to do and so on, will be really difficult for governments to maintain in Australia over the sort of medium term, I think, because of that sort of the culture of Australian society. We saw the big crackdowns came in both Victoria and New South Wales after people defied immediately any sense that they wouldn't be allowed to go to a beach. And so we had these sort of iconic scenes on Bondi Beach in Sydney, which is, for anyone who's travelled to Australia, usually goes there, of people just, jam-packed onto the beach while we're having this discussion about this catastrophic pandemic. Full of backpackers who have just arrived to come and see the wonderful Australia. We saw that here in Victoria over the Easter break, where local governments actually, Helen mentioned before, did act, and they physically shut down access to beaches so people couldn't swim or walk on the beach and so on, to try and stop people moving around. So a lot of that, I think, for the longer term strategy for government is going to be really difficult to keep people on sort of on the mark of doing that, just because of the sort of cultural psyche, I think, of Australia. So implementation for all the plans that we have and so on is always a challenge, but in an environment where people sort of tend to buck against the rules and have developed an attitude over a fairly long period that things will always work out, this is going to be a really big social challenge, I think.
Right. Well, thanks both very much. And I know it's your evening, so you can go off and relax now. Hopefully you haven't got anything else to do. So thanks for joining me. And as I said, I think we'll probably be having similar sorts of conversations again in the not too distant future. Thanks very much.
Thank you. Thanks, Colin.
Bye.